Hey, welcome back. This is Paramedic Project. Thanks for joining us once again. Today, I want to talk a little bit more about being a great second officer. And this really is what being a paramedic is all about. It's 50% of the workload. Yes, sometimes we're in here making great patient assessment and doing life-saving interventions. But the rest of the time we're doing emergency driving, we're carrying equipment in and out from the patient, and we're just contributing to a high-functioning team. And that's what gives this job so much variety, what makes it so great, what makes it so stimulating. And of course, all these endeavours are for great patient care outcomes, so it's very rewarding as well. But enough of why being a second officer is a worthy cause, and on to our second episode on being a great second officer. So the concept I wanted to share with you today is that of staging your equipment. So let's work through a case very, very quickly to illustrate that concept. So often we'll come into a scene, we'll assess the patient on approach, we'll move the patient to somewhere where we can get great access around the patient, we'll do a thorough assessment, we'll perform some interventions, maybe take away some of their pain, and then at some stage in this case, both officers, the patient care officer and also the second officer, starts asking themselves, what equipment is no longer required here? What equipment can we move away from the patient to give us more space to extricate them, to free up our hands to help us extricate them if we need to carry them, or if we need to help them mobilise if they're not really good on their feet. We start thinking that. Now there are two locations, obviously we can keep the gear, we can keep it here with the patient, or we can move it down to the ambulance. But I like to add in a couple of other locations, a couple of staging locations for this equipment as well. And let me just describe that a little bit more. So yes, we have essential equipment that we need to keep on the patient, for example, cardiac monitoring, or we might need some pharmacology nearby to continually treat them while we're extricating them as well. Then there's equipment that is definitely not required that we can take out the ambulance. And then there's also that in-between equipment that it's not needed right now, but if the patient deteriorates, then yes, we will need that equipment. And that's the equipment that I like to stage. I like to have a couple of staging points between where the patient is currently located and the ambulance. And that, if they're in a house, if they're in a room, the first staging area might be out near the patient's front door. And there might be a chair there for the patient, or somewhere where we can prop and wait for the patient. We can treat them a little bit more if they've deteriorated. And that equipment might be an oxygen kit, it might be a bag valve mask, we need to ventilate the patient at all. Might be some suction and other airway adjuncts, might be some other pharmacology. But that equipment is really related to the patient's logical deterioration from where they're at now clinically to where they might be able to go. So that's where the second officer has to keep their head in the game, needs to keep thinking about the patient's clinical needs, needs to think about the patient's logical deterioration down that clinical continuum. So that's the first thing. From there, when our patient gets there to a staging point, we can then move that equipment down towards our next staging point, which might be the stretcher, where we're going to load the patient on the stretcher. So we can have a couple of staging points between the patient's actual physical location and the ambulance. And that just means that the equipment we may need if the patient deteriorates is close enough that we can get to it easily, but far enough away that it frees up our hands to let us extricate the patient safely. It's been Paramedic Project. Thanks for joining us once again. Find us on social media, and we'll see you next time.